important. As I said earlier today at our launch of the conference with the government of Rwanda and the Ministry of Health, I deeply appreciate the leadership of Africa CDC and the commitment to boldly reimagining our continental future and for building resilient health systems and institutions. I will say a brief few points about what the inaugural conference has meant for Africa and global health as a whole, and my hopes for what it can be in the future. The focus of the inaugural conference, the first of its kind, was to address long-standing health challenges on the continent, including vaccine inequity and manufacturing capacity, the ongoing COVID-19 pandemic, and the need to build resilient health systems. As we mentioned earlier, Professor Binagao talked about that. The upcoming one will focus on post-pandemic recovery and preparedness as our continent navigates the way forward in a rapidly changing world. The pandemic, as we repeatedly highlighted during the conference and since, has revealed the disparities and deep inequities in global health. But as Dr. Ahmed earlier said, it has also showed us that Africa is far more capable of stepping up to solve its own problems and boldly shape its healthcare future than it is given credit for. This knowledge and insight should fuel everything we want to do with this platform and conference and any of our other regional efforts. So, what is the value of this platform? The 2021 event brought together over 12,000 public health stakeholders. That is a very impressive reach, and I'm certain this number will continue to grow. We also had the opportunity to hear the latest learnings and research outcomes from COVID-19 pandemic and recommendations for how we can be better prepared for future health crises. And this came from the over 200 African policymakers, scientists, public health experts, data experts, international partners, and civil society representatives. It became the much needed space for discovery, debate, and forging of a partnership based on science, research, data, and innovation for our continent. So the upcoming conference is our opportunity to further hone and solidify this platform as an esteemed space for regional research, innovation, and convening, and really conceiving and realizing creative solutions to our challenges and build sustainable health systems. Our continent is full of resources, talent, and inspiration. We all are witnessing as to what is possible when one of us is given an opportunity to thrive. It is really up to us to ensure young professionals, experienced researchers, and scientists in our midst get the platform and support system and confidence of their leadership and institutions behind them. And there is so much to learn from many African countries. It is so fitting the next conference is going to be in Rwanda, a country whose COVID-19 response has been one of the best examples, not just for the continent, but frankly for the world. The timely response, consistency, clarity, and how human life, even a single one, was always central and paramount concern is exemplary and is an impressive achievement. And that is why I believe, even if we ignore the many other compelling factors, this is why that's the perfect venue for our next conference. So to conclude, the inaugural conference showed the world that Africa is shaping its own destiny and creating spaces to tap into the immense potential of its people. This will have a seismic impact into how global health institutions and other nations engage with Africa and its regional platforms. And we should keep forging ahead in the direction and always make this new reality clear with each iteration of the conference and all other efforts to build Africa's new public health order. Thank you very much. And I, along my co-chair, the scientific committee, and the local committee, along with the government of Rwanda and Africa CDC, look forward to working with you. Thank you. And back to you, moderator.
Thank you very much. That was Professor Senait Fiseha. Now, between the three of our panelists today, we've had a global look at the situation of COVID-19, and we've also heard progress that is being made under the Conference of Public Health in Africa. So now it is the time for you to put forward your questions. As usual, please use our WhatsApp number, which is +251 94 550 2310, or come through live as well as through the question and answer section. I see that we already have a number of questions coming through. When we ask you to put forward your question, please just identify to whom your question is addressed and then proceed. So today, let us start with colleagues online and say hello to Sarah Jerving. Sarah, please go ahead.
Thank you so much. Dr. Ouma, you had mentioned that Sudan and Somalia have death rates above 5%. Is this new for these countries, or have they seen these high COVID-19 death rates in the past? And do you think that the drought in the Horn of Africa is or could make managing COVID cases more difficult? And sorry, just last one is, do you have any updates on Aspen's production of COVID-19 vaccines and their plans to close that production line? Thank you so much.
Please proceed, Dr. Ahmed.
Thank you, Wayne, and thank you, Sarah, for always asking the most difficult questions. Let's start with the high case fatality rate in the Horn of Africa, particularly. We do not have at the moment very clear evidence why it is high, so we cannot begin to link it to the drought. But the two things that this high fatality rate tells us is that, one, there is need to strengthen the health system there. Case fatality rate, by and large, is because the healthcare system is not handling the cases quick enough, identifying them quick enough, and handling them efficiently enough for us to be able to avoid those rates. But we cannot be able at this time to link it directly with the drought. But the situation of the drought, for sure, does provide more challenges for healthcare in general, and particularly for those who may need critical care. In as far as Aspen in South Africa is concerned, we have said from at the very beginning of the conversation on local production that market is the key to ensuring that we have a thriving local production, manufacturing enterprise. As we speak today, the way that the purchase of particularly vaccines is structured, it skews very heavily away from African producers, because those who are purchasing these vaccines are few, and the channels for opening up the purchasing capacity to come to Africa are also not broadly, if you want, shared with African producers. In this way, our message is that we need to have all those who are purchasing vaccines for the global, at the global level for African countries. They need to purchase those from African producers first, and then they can be able to go to non-African producers after. This is our ambition, this is our commitment, and this is the principle that we are pushing very hard, so that manufacturers like Aspen do not get to a situation where they would have to close. We hope it doesn't come to that. We are doing everything we can in the background to try and get those vaccines to be purchased, particularly for the African market. Thank you.
All right, thank you. James Chege Macharia of Reuters has a very similar question to the one that you've just answered, but let me just give you what he says to see if you have any extra comment on that. So he says South Africa's pharmaceutical company, Aspen, the executives of that company have said that all global multilateral organizations had indicated last year that they needed a regional Africa-based manufacturer. But now these organizations are not helping Aspen to get any orders, and the plant is producing below its capacity. And he's asking for your comment on that.
No, thanks, Wayne, and thanks, James. Very similar. I would only add one thing to what I've already said, and that is it is our responsibility, those of us who have this information, to share it as broadly as possible, because not just Aspen, but all the other manufacturing facilities we are developing on the continent, whether it is in Senegal, whether it is in Kenya, whether it is in Rwanda, Egypt, Algeria, Morocco, all those will require their products to be bought. We have a market in Africa. Those who are purchasing for Africa must change the way in which they purchase these vaccines so that our African producers are fast on the line to have their products being bought. Thank you.
Thank you, Ahmed. The following three questions are also directed to you, and they're coming from Janice Q, who is with Bloomberg. So Janice says, you talked about most of the countries experiencing a fifth wave having a more severe wave, that is the fifth wave. How does the Africa CDC define severe? Is that by sheer number of cases, or is there another measure of severe? And before you answer that question, I've just seen a message that's coming through from one of our panelists, who is Professor Senayet, and she has to leave. So, Prof, I don't know, before you leave, do you have something that you'd like to say within about a minute? Any extra commentary?
Not really. I just wanted to reiterate my gratitude and thank you for Africa CDC and AU for this much needed and timely leadership in convening the African scientific and public health community. And as a part of the co-chair, myself, along with my colleague, Professor Benegao, look forward to working with all of you to make the second, but first in-person meeting a success. So thank you very much for the opportunity.
All right. Thank you, Prof, and good luck with your next meeting.
Thank you.
All right.
Before Senayet leaves, I really need to ask one quick question, and to both of them, one to Senayet and one to Agnes. For Senayet, we are, and you're a co-chair, so I'm asking you this when you're wearing both hats, this co-chair and the other one, which I will not mention. But we have started the journey of a conference on the public health in Africa. And we know there are other similar conferences which don't cover Africa elsewhere. My question to you is, how can we be able to utilize the media connections, because the journalists are here, the media connections to ensure that those who attend public health conferences elsewhere can be able to actually make sure that CPHA is part of their annual travel agenda, if you want. And for Professor Agnes is to ask, on the African continent, we have a lot of institutions, whether they're academic or research, that actually will be the core of the future conferences of public health in Africa. How do we bring them on